let's get into it. So our first presenter is Isidora Sidorovska, and she is presenting on foundation responses to COVID-19. So go ahead.
Okay, this is great. Thanks so much, Kristen. I will actually, as fate would have it, of course, my internet crashed. So I'm going to ask now Catherine if she can share my presentation. And since I'm also signing from my phone, unfortunately, I will turn off my video as well while I'm presenting. And then I'm going to turn it on and hopefully it's going to work okay. So, yeah, Catherine, if we can just put it on, full screen. So the study I will be presenting today is basically an initial attempt to learn a bit more about how COVID-19 has affected the charitable sector in Canada. And we can just move to the next slide, Catherine. It basically consists of a series of case studies which are looking at the effects of the global pandemic over Canada's philanthropic community. And it was basically a first step in exploring the adaptive capacity of Canadian foundations to respond to the COVID-19 crisis. The goal was to capture some of the novel initiatives either developed or supported by Canadian foundations in response to the outbreak, and just see what kind of impact some of these initiatives might have in the future. The data from this analysis was actually meant to complement a systematic survey done by Philanthropic Foundations Canada, as well as a Delphi method-based examination of perspective of experts in the field. And we will actually hear a bit more about this by Dr. Rego today. So we can move to the next slide. Just before I get into the findings, a brief overview of the methods. What we did is we conducted 4 exploratory case studies. These included 8 in-depth interviews and also an analysis of relevant documents and other sources of data which were supplied by our interviewees. And these also note that these interviews were conducted during May 2020. So basically they reflect the initial responses of the pandemic, even though we did some follow-up interviews a year later, and these reports should also be available soon. So what were the research questions we were looking at? For one, how have grant-making foundations responded to COVID-19 in the early days of the pandemic? Then how do these changes relate to the dominant philanthropic model and practices? And eventually, we also try to look at some long-term implications or learnings that we could extract from these processes. Can we move to the next slide, please? So just briefly, what were the case studies around? We did one on the Lawson Foundation and its responses to COVID-19. So in this case, we were looking at the organization and the variety of tools and programs that it had developed in response to the pandemic. We also looked at the Indigenous Peoples Resilience Fund, IPRF. So this was an initiative set up by Indigenous knowledge holders in partnership with several funders as a tool to support Indigenous communities during the crisis. And well, this fund itself was created in response to COVID-19. It's actually not a temporary initiative, rather it was conceived as a long-term instrument intended to contribute to the resilience of Indigenous communities, and it really has grown to become a big pillar of Indigenous philanthropic infrastructure. We also looked at the GIF5, and this was also an early initiative among Canadian, mostly private, but also some community foundations, which aim to ask foundations to pledge at least 5% of their assets through charitable grants during 2020 in response to the pandemic. So the rationale behind the GIF5 campaign was that community organizations were facing declined resources while also looking at increased demand for service. And therefore, grant-making community had a responsibility to complement some of these disbalances. So the goal of GIF5 was to have at least 100 foundations to sign up for the pledge. This wasn't fully achieved, but it nevertheless did important work in raising questions around the disbursement quota and really contributed to conversations such as the other 95. And in the end, the fourth case study, it was meant to examine collaborations between private and community foundations, but we ended up looking at some much broader issues of the role and mandate of grant-making foundations in a changing society. So today I will present a summary of our findings, but actually all 4 case studies have short reports available at the PhiLab website, so I can share these the links later in the chat if anyone is interested to look at these a bit more in detail. If we can move to the next slide, please. Thanks. So one of the key components of foundation responses, especially during the early days of the COVID-19 crisis, was this greater reliance on local expertise to guide emergency programming. What our case studies identified is basically several examples of grant-making foundations which turn to local leaders and trusted collaborators of the organization with the purpose of allocating funds to communities. So the rationale behind this approach was to have community partners and really local people decide where emergency support should go in a timely manner. Apart from ensuring a really rapid availability of funding to local communities, this approach really allowed foundations to tap into local expertise and really make sure that funding is tailored to local needs. So, for example, the Lawson Foundation had established pop-up granting teams, which were composed of local trusted individuals that were made responsible for distributing emergency aid to local organizations. Usually, even the organizations themselves that were receiving the funds were unaware of the incoming support, and most of these funds were actually allocated outside the foundation's strategic impact areas and really focused on supporting food banks, mental health support, shelters, and so on. And I think that this move towards, let's say, priority funding was similar throughout all of the examples that we looked at. On a similar note, for example, the MasterCard Foundation set up an Indigenous Leadership and Insight Circle, which was comprised of Indigenous leaders and also which were also meant to guide their COVID-19 recovery and resilience program. However, I would say that perhaps the most notable example of foundation reliance on community expertise is the Indigenous Peoples Resilience Fund. So here, an Indigenous advisory group actually had full authority to define both the priorities as well as the operating procedures of a fund. So all of these changes in a way marked a shift to a model of philanthropy that was more grantee and community-led and where foundations really abandoned predetermined approaches and objectives and really relied on local groups and communities to decide what is best for them. Apart from explicitly setting up these advisory groups or local groups to lead their or to help their emergency allocations, the local leadership in the pandemic response also came to light as a result of the reestablishment of restricted as unrestricted funding. So as foundations moved, some foundations moved to allow organizations to use restricted funding as they see fit. They once again allowed for more bottom-up programming and also gave greater authority to grantees to allocate funding as they see fit, which includes both their support for local communities and how they want to adjust programs to respond to community needs, but also to, in adjusting and using these funds for the operational needs of their organizations. So overall, throughout the crisis, we can say that there was an increased flexibility, at least from the case studies and the examples that we saw, that there was an increased flexibility to better support grantees, as well as the changing priorities in the community. And while this adjustment was initially meant to serve a temporary purpose during the emergency created by the crisis, it still represents an important change in funding practices, and it's an interesting just idea to look at it a bit more in detail and what are its implications as we go forward. Can we move to the next slide? Thank you. The second component that was prevailing throughout our case studies was also the loosened rules and regulations, and this is basically increased flexibility of foundations and a bit greater power in the hands of grantees, which was complemented with either reduced or fully suspended application and reporting requirements. So in part, these reduced or removed application and reporting requirements were adjustments made to complement the move from restricted to unrestricted funding, but also as a way to reduce the administrative and management burdens to organizations and just ensure that community resources and organizational resources can really be directed to program operations rather than administrative tasks. So while it is important to note that application and reporting requirements are really important part of ensuring accountability, control, and effectiveness in the sector, at the same time, we need to know that the administrative burden of completing these procedures has often been a considerable strain, especially for smaller and less professionalized organizations. So in a way, taking a step back from these requirements may provide just the perspective of what are the key purposes that these tools need to achieve, and whether a bit less complex and less robust requirements may be more effective in achieving these purposes. Next slide. So another set of findings revolved around collaboration and learning. So our interviews showed that funders have really prioritized joint ventures and relied greatly on already established collaborations, networks, and pre-existing partnerships as readily available solutions. Additionally, philanthropic learning has also emerged as an important component of a few of the actions that were, quite a few of the actions that were taken by the funders we spoke to. So most of the funder initiatives we examined were collaborative in nature, like they were multi-funder efforts, and these partnerships in a way have allowed foundations to make more substantial contributions to local communities and to emergency issues, while also decreasing operating costs and increasing the amount that is available to grantees. These collaborations have also facilitated a swifter exchange of information. They were a way to ensure that funders complement each other rather than double efforts. Collaborations also, for some funders, presented with the opportunity to identify and pursue additional opportunities for joint action, which included more complex and large-scale issues, and that funders were able to raise and are otherwise unable to tackle independently. That being said, our interviews also showed that previous collaborations, trust, and mutual respect were core attributes that allowed many of these initiatives to develop quickly. For example, this was the case with the Indigenous Peoples Resilience Fund, where established networks, collaborations, and previous conversations really contributed to the swift establishment of a really big and really complex project within a very limited time frame. Throughout the initiatives that were taken by foundations, we also noticed a common emphasis on learning and growth, as well as developing and defining best practices. So for example, an important element of the IPRF, the Indigenous Peoples Resilience Fund, in the early process of its establishment was the existence of a funders table, which basically functioned as a forum for the exchange of information and ensuring foundations do not duplicate efforts, they can join forces, and they can learn from the process of setting up the fund. In this sense, it is very interesting to note that while some of the donors involved in the IPRF funders table eventually did not take part in the fund, at least in the beginning, they somehow remained engaged in these conversations, potentially pointing to the once again to this prevalence of learning and exchange between funders. Another example of this learning-oriented approach is some of the initiatives developed by the Lawson Foundation. So the Lawson Foundation, since the early days of the pandemic, actually removed their application and reporting requirements in an attempt to reduce the burden for their partners, and also move from restricted to unrestricted funding. However, in spite of canceling most of their application and reporting requirements, they still kept very short reports from grantees whose purpose was not to elicit grantee accountability, but rather to learn from these programs and altered practices. So while all, organizational learning is definitely an important component of the sector and has always been, it might also suggest perhaps a lack of best practices in facilitating emergency aid and the lack of guidance that Foundation felt that they had in this regard. Next slide. So the last common feature that we identified through these case studies is the attempt to balance short-term rapid responses with a more strategic application of emergency funding. And this was present actually in several of the initiatives we looked at. However, and this is a tension that is that has been the focus of various conversations in this past year, but it is interesting to see that the different initiatives we examined actually they decided to approach and address these tensions in different ways. So for the Lawson Foundation, for example, the balance consisted of funds being released gradually. In other words, early funding was meant to respond to emergency needs, regardless of the foundation's strategic areas, while later funding was tailored to provide support to community partners, while also being in line with more strategic organizational commitments. On the other hand, the IPRF decided to approach solving this tension differently. So despite pressing concerns and the urgency in the early days of the pandemic, the IPRF decided to take some time to develop a long-term decision-making infrastructure, strategic guidelines, and really work out their grant-making procedures before dispensing any funds, which was a bit different than the approaches we saw elsewhere. This was a rather quick process. They were still able to dispense funding as early as June, actually, I believe, but it nevertheless delayed the immediate availability of support from the IPRF. So going forward, it would be really interesting to see what the strengths and weaknesses of these of each of these approaches are when it comes to emergency funding, and whether this friction between responding to urgent needs and ensuring strategic effectiveness of scarce resources is and how is it connected to the philanthropic responses in emergencies. Therefore, the usefulness of both models really should be looked at through further studies. Next slide. So overall, our analysis showed some general changes to the dominant philanthropic practices, at least in the early days of the pandemic, and I have tried to summarize them here in four tendencies. So for one, throughout the crisis, there was a prominence of initiatives that relied on greater trust in grantees and greater flexibility in the funder-grantee relationship. So trust and flexibility were exemplified through the move from restricted to unrestricted funding, the reduction of application and reporting requirements, and the overall reliance on local expertise to guide the early phases of the pandemic response. As such, these were key traits of the foundational responses to the crisis. These practices also brought greater empowerment for grantees, as they allowed greater control of resources for organizations that are highly resource dependent, and in this way really contributed to the empowerment of these organizations. And at least temporarily, these changes have made room for a more collaborative and equal relationship between funders and grantees. So overall, this transition from project-based to core funding, the institution of linear administrative procedures, and the movement from funder-directed development toward a grant-making relationship that is more bottom-up and community-directed. So in a way, these adjustments make us mark a step back from the top-down tendency to direct, streamline, and rationalize community organization, and in this way, reduce the power disbalance towards a more equitable relationship. This shift also allowed for resilience and innovation as the sector really struggled to respond to increased demands while facing also declining resources. Some of the initiatives we looked at also raised issues around the policies that regulate philanthropic giving, and this was especially the case with the Give 5 initiative, which even though it was temporary, it sort of raised some of these issues around the policies that mandate grant-making foundations and their giving. So this includes the questions around the disbursement quota and also the tension between spending down philanthropic assets and the concept of philanthropic foundations existing in perpetuity.
If you could just wrap it up really quickly,
yes.
You're at 20 minutes.
Sure, yeah. We can go to the last slide, actually, as I'm done. I would say that in the end, the long-term implications of these temporarily altered approaches over accountability, program effectiveness, and community empowerment warrant further study. The question is it possible for a more flexible partnership-oriented model of collaboration between funders and grantees to be more conducive to philanthropic work as we try to achieve equity in social justice? At the same time, these other type of support may also contribute more sustainability for community support systems and grassroots initiatives that have really proven to be essential during the crisis and really make room for a more locally guided and self-empowering community action. Thank you.
Wonderful. Thank you very much for that presentation. That was super interesting. And I think we'll have a lot of complementarities with the next presentation that's coming up. We're going to hear next from Paloma Rego, who is going to be presenting some of the findings of the COVID-19 and philanthropy Delphi studies. So I'll pass it over to Paloma for a 20-minute presentation.